Welcome to Beyond the Bedside with Guardian Nurses. I'm Betty Long, President and CEO of Guardian Nurses.
I'm Rebecca Czarkowski, Vice President of Guardian Nurses.
And we have been working together for
11 years?
Yeah,
11
close.
years now.
Right? So
I'm in my 11th year.
And I'm in my 22nd, 23rd. But who's counting? Right? We have a combined total experience of nursing, 39 and 22? 23. So if you're doing the math, we'll let you answer in the comments. But we're here to talk about, this is one of my favorite
62.
topics. Okay, you're a savant, honestly.
Yeah, I'm a savant. That's funny.
So we are here to talk about one of the I think it's the most humorous topic in healthcare is price transparency. Most people don't know that there actually is a thing in healthcare called price transparency. But thanks to the Biden administration in 2021, implemented a across-the-board initiative for all healthcare systems.
And insurance, right? Healthcare systems, yes.
Right, to
provide pricing for any common, any common surgery, service, test, procedure,
blood work,
scans,
right.
So that it was interesting. It's because it's the smallest amount of healthcare is like catastrophic or unpredicted, but most healthcare you actually control your appointments. I was reading this whole thing. It was really interesting that I don't remember if it was 95% we can control. So they believe we should be consumers, which we should be, and shop to make sure that we're picking, not just because it costs less for the insurance company, but really because you're copaying, your out-of-pocket maximums and family maximums, they're all impacted. And so if you can get an MRI outpatient for $187 with insurance versus getting an MRI within a hospital setting for $449, like you're gonna,
lot more.
As a consumer, you would of course select the one that's more affordable. So that is the why, because we have the right to know, and we should be able to make decisions based on the transparency of costs, like any other service you purchase, you pay for, or any product you buy.
But it's not any product you buy. It's healthcare, and it's your health. It's your life sometimes, and you really don't know. It just gives you a price. It doesn't, if you can even find the price, which we'll talk about. But it's not just like buying a set of tires.
Correct.
Right? It's making sure that you're picking the right hospital. But so there's insurance and there's quality of care.
Yes.
Right?
Yes.
So the cheapest, like you get what you pay for type of thing, it may not hold true, because to your point, an MRI at an outpatient facility might be $188, but inside the hospital, because they have so much overhead and so many things to pay for, is $400 and something, right? Which is not a bad price actually for an MRI.
Yeah, I don't know if that was really it. I'm giving it just as an example. Do not quote me.
Right. We don't have any sponsors. We're not trying to sponsor.
No.
Go to the MRI at blank. But we are open to sponsors. Just saying.
Just saying. Travel, trips. So when you do go to look, I've been doing this quite frequently.
Wait a minute. Where are you going to look?
I'm
that's
telling
the
you
problem.
how to do this, and
okay,
and
all right.
Maybe some
write this down.
You're going to find.
Write this down,
okay,
because this is important.
It is. So the first place I tried actually a long time ago, just because I was curious about the cost of a certain surgery, not for me, I went onto my portal with my insurance company, and if you do go into that, it will give you like hospitals in your area, like an estimated cost with your benefit. So that's it's not really under the transparency piece, but you get some idea of spend. If you go to a hospital site, any hospital site, the main page, right?
Yep.
And you can search medical transparency.
No, price
Price
transparency.
transparency. Sorry.
Price transparency. That's the key words.
And what did we find when we've done that? So some hospitals, it's very user friendly. It will allow you to go in and click based on what you're looking for, prices on. It will ask you for some information. Some hospitals ask for just a little bit, like who's your carrier, what's your out of pocket, and your copay. You don't have to give any other information, your name or anything, and it'll give you quotes. The hospital will give you their quotes. Other hospitals make you or ask you to put in, they don't make you. If you want the transparency or the number, you have to enter your name, your address, your insurance number. And for me, that's not transparency anymore. Now you're collecting data on me to market me.
Right. Who wants to collect? Nobody wants to give their information. You just want to know what the MRI costs. You want to know what the shoulder surgery is going to cost or the knee surgery.
Right.
But they also ask for, if you don't know the exact name of what you're asking for, then you can't find it. Right.
Yes,
or if
correct.
So magnetic resonance imaging is an MRI, but it might be listed as magnetic resonance imaging. Who knows that, right? MRI. My doctor said I need an MRI. Some of them ask for codes. What's the CPT code, right?
There's no consistency is what we're saying to the transparency. Like they made it a law, great, but then nobody came up, strategized with a standard format for everybody to submit the same way so that as a consumer, you're looking apples to apples. Right. And so isn't that the irony? If nurses would have come up with this, I promise you, full circle. So that's a piece of it that, that can be a little bit difficult. But also what's interesting is not just the transparency, it's cost transparency when you don't have insurance. And so you can, if you don't have insurance, you can still get
there's going to be a lot of people that don't have insurance,
right.
So this might be timely for
and sometimes that out of pocket, though, it's really funny. It's like people are shocked. It can be less sometimes than than the total with insurance. Right? Because it's that game of like, we're billing the insurance company, they're only going to reimburse this much. The consumer or the insured has to pay a differential. It's like this whole crazy game. And then somebody who goes in, I have quite a few friends who don't have insurance who will go in and have to get an x-ray. She had to get an x-ray of her daughter's arm, and she paid out of pocket at a freestanding facility, and it was like $212.
Right,
but
don't you have to ask for the cash price?
Yes,
right.
But if you have insurance, you can't pay cash.
Correct, but if you don't have, if you don't have insurance, you can ask for a cash price, and it's usually heavily discounted. Correct. To your point, because they're happy to get the cash, because they probably are getting more from you for cash than they would be from an insurance company.
After they pay everybody.
Like, so she
involved.
paid $225, say. Mm-hmm. Maybe the reimbursement from Aetna would be $150.
Right.
So they're still making more with cash.
Yes.
Right. So I think it's the Byzantine structure of health insurance in our country, that it's your copay, it's your co-insurance, it's this, it's that. But if you go in and say cash, it's a lot cleaner, mm-hmm. right? But a lot of people don't have the cash to pay, which is a whole nother topic. Right. But I know that it's been almost 5 years since price transparency, and I think that most health systems are complying, because initially they were not complying, and they were being penalized mm-hmm. by the federal government in order to get them on the hook to get these prices mm-hmm. on the website and to make it easy to find. I remember the first couple, I guess it was the first couple of months, I went into one of the larger academic medical centers in Philadelphia and tried to find it. And the spreadsheet was like 1,000 pages.
I was going to say to you, in my research, that was, they were just data dumping, right? With no...
They didn't have any idea what you were looking at.
I was listening in preparation to a lot of different podcasts and experts.
Yeah.
And I don't know if it's still happening, and I didn't come across it with my little bit of research, but they were saying that that's all they were doing was just dumping. And then unless you could convert it to a readable file that makes sense to you, the consumer.
Right.
You're
Price
all up.
transparency doesn't really equate to understanding what it is you're paying. That's different. I know that there is a health system in New Jersey that we got there. I think it's almost 500 pages of what typically is called a charge description master.
Mm-hmm.
Remember those? Where you could look up. So every item in the hospital that's being charged is listed, right? And I was telling you about we looked up MRI, and MRI for the arm or MRI for the abdomen was a 2,500. I'm making the numbers up. MRI the brain was 4,500. MRI of the lower extremity was 2,500. And I said to Rebecca, why are they all different prices? It's the same machine. You're going in, you're getting an MRI. Maybe the length of time that you're in the machine is different. Maybe that's the difference. But again, price transparency. Well, why is the MRI the head less expensive than the abdomen? So that I was curious about that.
Yeah.
Right.
And you noticed that PET scans weren't different.
Right. The PET scan was all one price.
Didn't matter.
Right.
What
Didn't matter.
Body part.
Yeah. And I was really curious about what the most expensive item was in the hospital. I did find a few that were a stent, so a cardiac stent, a stent that they put in to a coronary artery to open up, keep the artery open and possibly save your life, was like $39,000. And the stent is like microscopic.
Mm-hmm. That keeps you alive.
Right.
$39,000.
But the other thing that was interesting, and I often go on this soapbox a little bit, nursing is not listed. Nursing is not a revenue generator for a hospital. We are part of the room and board.
But are we?
That's great.
They're missing out on like the special sauce.
Yeah.
If you actually use nurses.
Rebecca and I are big fans of charging for the value of nursing, because when nursing does its job well, oftentimes patients have better outcomes, are discharged better, and don't come back to the hospital, and have better experiences. But nobody cares.
And you know
We're
what
just
else
part
happens?
of the room and board.
The spend starts to go down too, because people are healthier.
Right, but that necessarily wouldn't help a hospital. They want to keep you in because they get more.
You're always taking me there, nurse.
But I think that if they're charging $2,500 a room night, that's where nursing is built in, right? So housekeeping, it's a lot of the infrastructure is built into that room rate. So you might see that when you get your explanation of benefits. But I was curious about that. I thought, they're charging for the little alcohol wipes, teeny weeny 1-inch square alcohol wipes, but they're not charging for the nursing care. And I know there's an initiative, one of our colleagues, Rebecca Love, the Commission for Nurse Reimbursement. Right. So Rebecca is generating that energy to try to get attention brought to the fact that it might not be a bad idea to charge for nurses, right? To charge for the nursing care, excuse me, not for the nurses. Yeah. Charge for the nursing care. It's interesting how it might be structured, because you would maybe break out the price or the charge, I said, for nursing for 8 hours, because that's how budgets are made for nursing departments, right? An 8-hour shift, FTEs, right? So there's a budget for the nursing department, but we're built into the room and board. So I'd be curious how much charge is built into that per diem rate to cover nursing, and is it enough? It'd be interesting to discuss, to actually explore that, because my fantasy is always to have bought a hospital. This is one of my fantasies, and call it Nurses Hospital, because you would attract the best nurses, because you would get the best outcomes, and that would attract the best doctors, because the doctors know that when the nurses are good, their lives are a little easier, a little easier.
The collaboration,
and their patients do better.
Yes.
right?
Yeah.
So that was my fantasy, to be able to buy a hospital, call it Nurses Hospital, attract all the good
I
nurses,
love it.
and then attract all the rest, because it would be
How about your stadium idea?
my stadium. Yeah. That's the other fantasy, is to have a Guardian Nurses Stadium, right? And
Lincoln Financial,
it might-
powered by Guardian Nurses.
yes, Jeffrey Lurie, if you're listening. Come on, just for a week, just for a game. Come on, a game.
Throw me a bone. So no, I think the important thing with transparency is, unfortunately, in the United States, we approach healthcare as a product, a service, and we are the consumers of that.
It's a commodity. Right?
In other countries, it's just, you're right. So here, knowing now that you can take a minute when you have that minute without needing to go to an ER, I'm not insinuating you delay any emergent care, but when you know that you're looking to find a new primary care, search for the health systems that are best outcomes, but also meet your financial ability. So you can always access good old Google and do your research, because you should be smart consumers of your healthcare, because that's the way we deliver it here. So
yeah, so if you're going online, if you want to look up pricing, go to the health system that you're familiar with or interested in going to, type in
price transparency.
Very good. Price transparency, and then explore what options there are. Put your name in, and then look at if it's a procedure, like maybe a total knee replacement, or perhaps blood work, or even a diagnostic study, right?
Correct. You could do if you get back injections or
right.
PT.
But
you
again,
should be able to look anything up, can't you?
But again, the crux of this is going to be, what is it called? So you can work with your provider or look it up online to understand what the procedure is called, because what you think it might be called may not be listed.
Yes.
So, but just do your homework if you can. Go on to the health system, look up price transparency, and then start digging. But leave yourself some time, because it might take you a little bit of time to find out what you're looking for. And if you do call, perhaps you call the radiology department and ask them what the MRI is priced. They won't know. Chances
but they
are
might give you a phone number.
When we called, I'm sorry to belabor this.
No.
When we called, when this initially came out, we spent some time calling and said, "Hi, I was just curious what your cash price is for a chest X-ray." Cash price? Who pays cash? Right? Like, it was so foreign that nobody really understood what the actual price was. It's not like they have it at their desk to say, "Oh, chest X-ray is $250," right? Anyway.
Yeah, I think urgent cares, though, they have kind of an all embedded, like, this is the cost for this visit, like, no surprises, because people do pay out of pocket a lot at urgent care. And so I guess that's kind of a good transparency, because they do have these books right next to them, so that they can say, okay, you don't have insurance, the entire visit will be blank.
Right. Well, when I was traveling in Hawaii and I had to go to the urgent care, it was cash, and I had to agree to pay that amount. When I was in England and needed to go to the dentist, they listed out what exactly I had to pay for, and it was either agree or leave without a tooth. So, I chose signature. We hope you learned something about price transparency, if nothing else, to know that that's how you should look it up on your health system's website. Okay? Thanks for watching. We'll see you next time.
See you soon.